Salt is everywhere. This sneaky ingredient is found in so many of the things we eat every day. Many Americans unknowingly eat much more salt than they need because they aren't always aware of the foods that contain high amounts. You don't need a bloodhound to find hidden salt. Look at the food label. You may not be able to taste it or see it, but the chances are it's in there. Hi, I'm Dr. Jaganathan. I'm a cardiologist specializing in heart failure at the Florence Warmeld Heart and Vascular Institute at St. Elizabeth. Our relationship with salt is complex. On one hand, it helps in preserving foods. It enhances flavors and impacts our body's fluid levels. On the other hand, too much salt can lead to kidney disease, bloating, and high blood pressure. It's important to know how to keep your salt intake in check and understand the health benefits of doing so. Sodium is a naturally occurring mineral, one of the chemical elements in salt. Sodium is very essential in how our body works. Our body needs sodium to function appropriately. Well, most sodium in your diet comes from processed, packaged foods, restaurant foods, not necessarily table salt. Yes, it is necessary for our bodies to function. It helps our body retain water. It's basically volume. Our blood vessels need volume. A lot of our body composition is water. We need to retain some degree of water in our body in order for it to function appropriately. Yes, 1,000%. Too much sodium makes you retain more fluid in your body than what's needed. For that reason, it can raise your blood pressure. High blood pressure also causes damage to the blood vessels in our body, leading to other vascular disorders. Per the American Heart Association, most adults should not consume more than 2,300 milligrams of sodium a day. Ideally less than 2,000 milligrams or 2 grams per day. In heart failure, we recommend less than 2,000 milligrams per day. That's a blanket limitation for all of our heart patients. Same for those with hypertension and vascular disease. Processed foods are packaged foods. They're foods that we buy in the store, like TV dinners and canned goods, which include canned soups and even vegetables. They include condiments as well. There are foods that we're not freshly preparing at home. For prepared foods to have a longer shelf life, manufacturers use sodium to help preserve the food. For example, canned soup can have at least 500 milligrams of sodium, which is a quarter of your daily intake. A TV dinner has at least 1,000 milligrams of sodium, which is half of a daily intake. And condiments like mustard, ketchup, and barbecue sauce can have 200 to 300 milligrams of sodium in one serving size. It's very important to avoid foods like that. One packaged meal can be half of your daily recommendation for sodium. Not all high sodium foods taste salty. Some foods may not taste salty at all, but they can still be high in sodium. Using taste alone is not an accurate way to judge a food's sodium content. It's important to read food labels to look for hidden salt. The DASH diet is a dietary approaches to stop hypertension diet. It's a healthy eating plan that's designed to help lower blood pressure and reduce the risk of heart disease. It emphasizes fruits, vegetables, and lean proteins. It restricts red meat, salt, added sugars, and fat. There's not one that's healthier than the other. They all contain about the same amount of sodium. Choosing which type of salt to use comes down to taste and preference. Number 1, make a habit of reading labels. Number 2, eat more home-cooked meals rather than store-bought or restaurant foods. Number 3, avoid high-sodium sauces like dressings and condiments. That's a place where there's a lot of hidden sodium. Experiment with herbs, spices, and lemon as ways of substituting salt without sacrificing flavor. These add flavorful accents to meals and offer fantastic health benefits. Thanks for taking the time to learn about the importance of decreasing salt in your daily food choices. Removing the shaker from your table may be a good place to start, but reading your food labels is even better. Check out the other segments from the St. Elizabeth Take Time for Your Heart program to discover more lifestyle tips to help lower your risk of heart disease.